how to get into residency if this is something that interests you and is something that you want to do. So let me continue. So for kind of about me, I'm kind of an odd case. I knew I wanted to do dentistry from a very young age. I still remember telling my mom actually tells me that I came up to her when I was like 5 and said, "Hey mom, like when I grow up, I want to be a dentist when I grow up." So of course, you know, like at that age, my mom like, oh, it's just like one of those things where young boys want to be like a police officer or astronaut or something. So she never like really gave it much thought. And looking back, I feel growing up, so I feel like that definitely left a very positive influence on me. And so this kind of goes into me being a senior in high school and actually junior high school. So that's when I started shadowing my pediatric dentist, the one who pretty much influenced me to get into this field. And so it was during like the summers, it was very chill, it was very casual. I just kind of actually biked to my pediatric dentist office, but I didn't have a license at the time. And then I was just kind of shadowing on the procedures and even helping set up some of the trays, and just watching that and everything in action really kind of opened my eyes up. And it was during that summer of like junior year that I just kind of told myself, like, when I grow up, not only do I want to become a dentist, but a pediatric dentist. And so coming to the senior year of my high school, I applied to various accelerated dental programs just because I already knew what I wanted to do. So that way I want to fast track that process to kind of go into that endpoint a little bit faster versus, you know, spending a little bit of time and maybe and more money in, you know, some other avenues by doing the typical like 4 years of undergrad and then 4 years of dental school. And so that's part of the reason why the UOP pre-dental accelerator program really, you know, catered to my interests. And so I applied to it during the senior year of high school. And then, so I did 3 years. So I was part of the 3+3 program. So for the UOP pre-dental program, so for like my high schoolers who are watching this, it's something that I applied to during the senior high school. So there's a 2+3 program, a 3+3 program, and a 4+3 program. So for the 2+3 program, you do undergrad in 2 years and then finish dental school in 3 years. So a lot of people graduate very, very young. So it's 5 years of training. So a lot of times the graduates are like 21 or 22 and they are dentists, you know, and so very young, so it kind of definitely fast tracks the process. So personally for me, I originally came in as a 2+3 program, but I decided it was a little bit too fast for me because I also wanted to earn a bachelor's degree. A lot of the folks in the 2+3 program, just because of how fast track it is, they don't end up getting a bachelor's degree. And a lot of times if you do want to specialize, that's something they are looking for. So I decided to slow down a little bit. It's still pretty fast in my opinion to do the 3+3 accelerated dental program. And so I did undergrad, 3 years, got a bachelor's in bio, and then I'm class of 2021 for dental school. This is the dental school in San Francisco, the UOP Dental School. And then currently right now I am at a pediatric dental residency in Milwaukee, Wisconsin. So it was actually quite a move for me because I was born and raised in California. So now I'm all the way over here in Milwaukee, Wisconsin. And so for this right here, this is kind of a little quick advice for my pre-dental students out there. Nothing really like profound, because honestly, a lot of times it's just working hard, but being very consistent at it. So for some things that personally helped me was creating realistic and achievable goals. A lot of times our goals are way too lofty that they just become too intimidating. We never really work on it. So creating these very manageable and realistic goals are definitely a good way to, you know, accomplish something really big in the end. So setting these very small goals, and then once you kind of look and step back, realize just how much you accomplished. So just definitely celebrate your victories too. For me too, finding a way to de-stress is really huge. For me personally, it was gymming. It was something I picked up. I was in college. A lot of people, you know, they like drawing or music or hanging out with friends. I feel like just as important as making sure you really work hard and grind in classes and everything like that, you definitely need like a mental health break and finding a way to really calm down. And that actually helps, you know, when you're in the classrooms, that way you're more productive and more focused as opposed to just being completely burnt out. Seeking mentorship was huge. The benefits of being in a dental program for the accelerator program was there were a lot of upperclassmen who were on the same path as you. So you knew exactly what classes to take, which professors were, you know, hard graders, which ones were easier graders. and all those little tips of, what should I study for my DAT, where I could use like useful resources, where I could interview tips, all those things that, maybe the upperclassmen went through, they can kind of relay that onto you. So they become almost like a big brother, big sister figure. So personally for me, that was very, very huge. And I'll kind of talk about that in dental school, as well as making friends with those upperclassmen was really helpful for me. And for some helpful upper div bio classes that I found helpful was histo, biochem, microbiome, anatomy, and physio. So for these core classes, there are a lot of classes in dental school that cover the subjects. So just kind of already being exposed to the words and terminology made, relearning the concepts so much easier a second time. So I highly really recommend taking these classes. One thing too is learning from your setbacks. There's been a lot of times where, I studied really hard, but I still didn't get the result that I wanted to. And in the beginning, I would just, get really down and hard on myself and not really learn why I made those mistakes. And as a result, I kept on making the same mistake. So I eventually learned to really kind of analyze and kind of think about what the problem was. And by knowing exactly what caused the problem, then I could kind of solve and improve over time. And there's a little concept within gymming. So that's kind of what I learned from doing research for lifting. It's called progressive overload. This kind of goes back to like this Greek folklore about this young boy who had a young calf, like a calf that he grew up with. And every day he would lift the calf up on his shoulder and kind of walk up a mountain. And so initially the boy was very small and the calf was very small, but each day the boy got a little bigger and the calf got a little bigger. And then towards the end, the guy was massive and the calf was massive, and definitely didn't happen overnight. It was progressive overload. So every single day it progressively got heavier and bigger. So same thing with kind of studying or any other little goals that you set for yourself. Make sure that it's within reason. So if maybe today your goal is to have complete focus for 30 minutes, just set that goal for yourself. And then maybe the next time, let's do 35 minutes of focus. And so just kind of breaking up for yourself to make sure it's nice and manageable versus saying, okay, today I have complete focus for 5 hours. And that's really not realistic if you can't even focus for 15 minutes. So those are kind of additional tips I have below. Celebrating your victories, getting to know your professors. I know, especially for now, I know it's getting better, especially if it's over Zoom. It's really hard communicating with your professors, but I would assume that maybe like emailing to them and be having one-on-one Zoom conferences would be a way to kind of compensate for the situation with Zoom. So definitely understand COVID makes everything super hard, but doing little things like getting to know your professor even through a Zoom meeting or emails like that is for little ways you can kind of set yourself apart from maybe other people. So for my advice for those currently in dental school, big thing that I would like to say is being prepared to fail. I know this sounds very depressing, but in dental school, you will fail. In college, I definitely did bad, but I never really technically failed. But definitely in dental school, I failed so many times. I did remedials, and I just felt like the imposter syndrome was very, very strong. So like everyone else was so accomplished, so smarter. I just felt like, oh, maybe I wasn't meant to be in this position. I'm probably the odd one out. So, and after talking to a lot of my classmates too, they felt that as well. So definitely don't feel bad if you fail. And again, kind of like an undergrad too, not just what's really important is learning from your failures. I know it's going to suck in the beginning, just seeing that failure on, maybe your crown prep or something like that. You spent hours and hours practicing, you still fail. It's definitely very sad, but kind of digging down and really thinking why you failed and analyzing and kind of correcting it is really a way that something that I kind of took and used to kind of improve on myself. One thing that's cool about dental school we kind of forget is a lot of times your faculty, they were in your shoes before too, and now a lot of them are practicing dentists for their own practices. So definitely using your faculty as resources. You don't have to just ask your faculty for prep checks and signing off your lab work or things like that. You can, talk to them about maybe how maybe they open their businesses or tips on how they manage their staff or things like that, and really chatting with them and, getting all the information you can out of them. And they're very, very nice people usually. So just really socializing this with your faculty is very useful as well. And another interesting about the dental school environment is there's almost like a safety net. So if you're doing a very difficult case and maybe you're having difficulty controlling the bleeding from the gingiva and you can't really get a seal and you're trying to do a composite fill or something like that, you're starting to panic, there's always a faculty nearby. You can just ask them really quick. So I'll definitely take, my advice is to push yourself outside of your comfort zone dental school. That's a really way to grow, just because you have that safety net of having those faculty kind of jump in if you are struggling with those difficult cases as well. And like, again, I said seeking mentorship was really huge. I had a lot of people that I looked up in dental school. And so I really kind of picked their brains and, asked them for advice on, how to accomplish my goal, which ultimately was to get into a pediatric dental residency. So I'm going to talk a little bit about kind of defining what pediatric dentistry is now. So for pediatric dentistry, the definition on the ADA website is an age-defined specialty that provides both primary and comprehensive preventative and therapeutic oral health care for infants and children through adolescents, including those with special healthcare needs. So a lot of this is pretty obvious, like, oh, pediatric dentistry just means you work with kids, right? So that's definitely true, but I feel like towards the end, the definition is very, very important, including those with special healthcare needs. So for pediatric dentistry, a lot of times you work with kiddos that have Down syndrome or all these very other syndromes that maybe are not as well known, like Angelman syndrome or Prader-Willi syndrome and things like that. And each of these syndromes, they have their associated physiologic conditions with it. Like a lot of times kids with Down syndrome have patent ductus arteriosus, or they'll have, overretained roots or tardontism. So all these little things that you kind of learn through residency and how to take care of those kids with those special healthcare needs. And a lot of times too, those kids with special healthcare needs stay within your practice. And so one of my attendings, she's been at our residency for probably over 30 years. A lot of her patients, they're like 35 and 40 and still seeing her in the pediatric dental setting. So that's pretty interesting. So that's one thing that I wasn't really aware of before getting to a pediatric dental residency, but just the amount of special healthcare needs and those with complex healthcare needs is something that you really do get experience with in a residency and for those specialists, for those pediatric dental specialists. So for kind of common procedures for a pediatric dentist, it's kind of your typical bread and butter fillings, sealants, stainless steel crowns, strip crowns, things like that, and root canal procedures like pulpotomies, pulpectomies, trauma, and also some more specialized stuff like doing full mouth rehabs under general anesthesia, oral conscious sedation, IV sedations, and even doing early interceptive orthodontics. And one thing kind of at the very bottom too is almost in a sense, we're not really nutritionists, but we do a lot of nutrition counseling. Because a lot of times families aren't aware that certain habits are contributing to the rampant caries and cavities their kids are facing. Like just today, I was talking to this mom that wasn't aware that putting a baby to bed with a milk bottle was what was contributing to all the cavities the kid was having. So doing those little nutritional counseling with parents is something that I feel is very huge and I guess different from maybe what a general dentist does in talking to his or her patients, for the adult patients. And for this, if you think pediatric dentistry is kind of interesting, if you kind of check off yes on, one or even multiple points listed here, definitely think you should definitely consider it and maybe shadow a pediatric dentist. If you like working with kids, if you like a fast-paced work environment, good compensation, good work-life balance, these are all things that you can enjoy by being a pediatric dentist, as well as this. I personally believe, I'm very biased, but this career is very fulfilling and impactful as you are setting this kid up for the rest of his or her life in dentistry. I've had a lot of patients in dental school who are adults and they're like 70 or 80, and they just have this severe dental trauma, and all just stem from their really bad experiences being a little kid. And I just kind of thought to myself, maybe this 7-year-old wouldn't be in full dentures if maybe he had a great experience growing up. Because a lot of times these patients are so scared of going to dentists from their bad experiences that when they're older and they have control over their own healthcare, they just never go to the dentist out of that fear that, oh, I'll get a bunch of shots and drilled up and everything like that. So and then eventually it becomes too late and they'll need to pull the tooth out and they'll be in full denture. So that's kind of the sad case. So definitely, I feel like this career is very impactful. I mean, I'm not a pediatric dentist yet, but even from my initial few months in residency, I definitely feel that impact right now. And personally for me too, I've always been this person that wanted to be really good at everything versus, very good at one thing versus very good at everything. So I just want to tell the parent that, I've trained and I can do everything possible to provide the best possible care for a child. And I never really like the concept of, just being mediocre at one thing. So just kind of a personal thing. So we feel like that kind of aligns with your own kind of values. I'll definitely, consider pediatric dentistry. That's kind of your case right there. And so kind of more specific for what is a pediatric dental residency. So it's something you do after you finish dental school. So typically it's 2 years. Some programs are 3 years. I think University of North Carolina at Chapel Hill and UCSF, those are some 3-year programs out there. And so essentially with the pediatric dental residency, at the end of it, you'll become a pediatric dentist, a specialist, and you receive additional training on some stuff listed here, like oral path, child-related pharmacology, radiology, child development, management of trauma. That's huge. A lot of times when you're in residency, you are managing trauma and you're on call. So if a kid maybe fell flat on its face or something, I'll kind of go over this with the case I have later on. You'll be treating and managing that kid along with, of course, working with other of your medical colleagues like ENT and plastics and things like that, especially when you're managing a severe trauma. And so if you feel like pediatric dental residency is something you're very interested in, these are some things that you can do to help increase your chances of matching or getting to one. So of course, having a strong GPA and class ranking is very beneficial, but maybe if you have a mediocre one, doesn't mean your chances are very bad. You definitely compensate with other parts in your application, such as having a very strong letter of rec, and a personal statement is huge. Program directors and all those evaluators, they read hundreds and hundreds of personal statements. So after reading that many personal statements, I feel like they can definitely tell when something's genuine versus something that's just made up. So definitely be true to yourself. And I know it sounds very hard, but having a cookie cutter personal statement is not very beneficial just because they probably won't pay much attention to it. And so your letter might, personal statement might end up towards the bottom of the list. So definitely try coming with something unique, but also very genuine. Research in dental schools, I didn't personally really do research, but I know a lot of my colleagues who did do it. That's just one of those things that maybe if you have a lot of interest in, just do it. So personally for me, what I'll advocate is doing something that really interests you. If you really enjoy doing like community service, or maybe are really passionate about teaching or something like that, get really involved with it versus spreading yourself very thin and having very minimal experience in one aspect and having everything. So it's better to be to kind of show your interest in one thing, and program directors and residencies will kind of know about that. So personally for me, I also was involved in various community service events, especially those helping kiddos. UOP would have Give a Kids a Smile annually, and it's an event where we'll provide free dental sealants and kind of screenings to kids in our SF community. And part of it too was we'll have these little booths where we'll talk to these little kids and offer brushing and flossing advice, as well as nutrition counseling. And one thing too is called the ADAT. ADAT is not required for a pediatric dental residencies. I know I think some residencies do require it, but majority of them don't. That's just another thing where you feel like maybe if you feel like your GPA or class ranking doesn't really define you doesn't really define your abilities to succeed in a residency, you can take an ADAT, which is like this test that proves to residencies that although maybe my GPA is not really reflective of my abilities, I have this really good score in the ADAT. So it's another way to prove yourself to a residency. And some people too who are in residencies, they've already done a GP or AGD. This is pretty much like a residency for general dentistry. So a lot of times people do dental school, then apply to a GP or AGD. So they finish their residency in general dentistry, and then they apply to pediatric dental residency. And that just additional things you can do to kind of add to your resume for that more experience to prove to residencies that you are qualified. So this is kind of a typical day in the life of my day as a pediatric dental resident. We have lecture from 7:30 to 8:30 a.m. Lecture can range from topics anywhere from lit reviews, so where we talk about maybe like indirect pulpotomies or even things of behavior management or things like that, or having ortho lectures with our full-time faculty who's also an orthodontist, having those lectures, or even having behavior management lectures with our attending. So just different lectures that our attending set up to prepare us to succeed for our board exams. And for the rest of the day, I'll see around 4 patients before lunch. Then after lunch, around like 3 patients, so a total around 7 patients in my own column. And then in addition to our own column, we run, there's 2 hygiene columns that me and my other fellow co-residents run. So typically it's around addition 5 to 7 patients. So total patients seen per day, I'll see on average, it definitely varies depending on rotation where you're at, but it's around 12 to 15 patients per day. So for me, that was a big change from dental school. So when you're in dental school, usually you'll see maybe 1 to 2 patients a day. If it's a very busy day, it'll be 3 patients a day. So suddenly seeing this many patients was a very big eye opener for me. So I had to really become more efficient and pick up my speed. That was something that I was very worried about, that, oh, maybe I'll just be too slow, because a lot of times people coming to a dental residency, they already maybe practice for a couple of years, so they already have that built up speed and confidence. But I definitely feel like after a couple of months in, you definitely learn these little tactics on, how to improve your speed and being more efficient. So if you're worrying about, being too slow or seeing that many patients, definitely that's a valid concern, but you will definitely learn and adjust to it. And in addition, we are on call 7 days a month. And so when we're on call, whenever that pager goes off, and we believe that it's something that where we need to go and see that kid, we will go no matter what time of day. It could be 4 a.m. in the morning, 2:30 a.m. in the morning, you have to go in. That's just part of being on call. And even though it might seem like a chore at times, it's definitely a way where you can improve upon your ways of managing trauma. And that's something that's very huge, especially when you're in private practice. And in addition, part of residency too, you'll have various rotations, offsite clinics, and OR days. So just kind of give you a preview of different types of rotations we do. We'll have like a cleft palate rotation, a pediatric medicine rotation with the various MDs in the hospital, leukemia, lymphoma clinic, and anesthesia clinic, where we're working with anesthesiologists, and they're teaching us how to intubate patients in the OR, and also an ambulatory rotation. And also what's pretty interesting too is we have a rotation where we go to the Marquette Dental School, and we're pretty much teaching the dental students there about pediatric dentistry, and we're in clinic with them, giving them swipes and kind of helping them in clinic and things like that. So I think that's pretty cool. It's definitely a very diverse range of different experiences that you'll get. So this is kind of a case that I did while I was in clinic. So for this, this is a case of generalized enamel hypoplasia. That's a mouthful, but pretty much what it means is that all the teeth have a condition where the outer layer of the enamel is less in quantity and less in quality. So pretty much that leaves the kid very, very sensitive and very, very high risk to developing cavities. So you can probably see the teeth on the left. This is the pre-op photo. A lot of the teeth are very deformed in different colors. And this is all just due to the fact of those teeth not forming properly while the kid was very, very young. So for this patient in particular, it's a 12-year-old. She had extreme dental hypersensitivity. That just means that she was very sensitive to eating. So a lot of times when she was even eating food, she could barely even eat because it was so painful. So that definitely affected the quality of her life, and as well as aesthetics. When you're a little kid and you have teeth that don't really look normal like other kids, you'll definitely get teased. So that's something that definitely affected my patient. So in order to treat this, what I ended up doing was I did strip crowns. So strip crowns are something where you have like a prefabricated template and you put in your filling material and it pretty much covers the tooth. So it's almost like a crown. So I used glass ionomer strip crowns on tooth numbers 6, 8, 9, 11. So I did it on the 2 canines and the 2 front teeth. And so my reasoning for doing this was to, in a sense, protect the teeth. Because those teeth are so sensitive and being exposed, by encasing them in these crowns, it protects them from the rest of the oral environment, prevents them, from getting cavities. And what's really cool about this material called glass ionomer, it's different from your normal, what we call white filling or composite resin. It's this material that, what it does, it actively releases fluoride. And so when fluoride is released, it definitely helps, prevent additional cavities from forming, and hopefully maybe even mitigating the sensitivity in that. And so what's the other thing about this case too was I didn't remove any tooth structure. So everything was done by just placing these crowns on. And part of the reasoning why was because I just wanted to preserve as much tooth structure as possible. So that way, once my patient did grow up and her growth stabilized, then that way she could maybe see like a prosthodontist or someone like that to really give her more definitive restorations. And so definitely at that point, they'll need all the tooth structure possible. So that's part of my reasoning for not prepping in the teeth and removing a tooth structure with the burr. And just kind of digging into the medical history of this patient, this generalized enamel hypoplasia was due to her conditions, autoimmune polyendocrinopathy, autoimmune hypoparathyroidism, and acquired hypothyroidism. So these are all things kind of affecting her thyroid. And I don't know if you remember back to physiology with physio, the parathyroid hormone, it regulates the calcium levels in the blood. So if the calcium levels are low, it releases it and increases the amount of calcium in your blood. And so a lot of times when you have problems with your thyroid, it affects the balance of the ions in it. And as you probably know, our teeth are made up of a bunch of these minerals and things like calcium. So when this balance is messed up, as a result, your teeth are not formed with the proper quality and quantity. So that's part of the reason why the patient presented like that. So definitely it was a very good feeling after finishing those crowns, just seeing her smile, and the parents are really, really happy. So that felt really good, kind of helping that kid out. So this is the second case I've never seen before. Residency, it's called Molar incisor malformation. So right here, what you see is a pano, and then also the PA of the tooth. There's a big radiolucency. That just means that dark kind of black shadowing area you see right there on the right. That just means there's active infection going over there. And so for this patient, it was an 11-year-old kid, and he just had chronic recurrent abscesses formed on and off for the past 2 years. And this kid was just had current chronic pain for the past 2 years. And I don't know about you, but I had tooth pain beforehand. It's one of the worst pains you could imagine. So I can imagine what this kid was feeling just for 2 years straight. And this kid was hopped up on antibiotics for those times just to help with infection. And so this kid was definitely suffering for a very long time. And it was actually last week he came in and he presented with pain in the upper anterior region. And he had some very large facial and palatal abscesses. I can kind of show you in the next images. And for his 2 front teeth, those were his permanent teeth. They were very mobile, but there weren't any caries. So this kind of all goes back to the molar incisor malformation. This means that when this kid was very, very young and those permanent teeth were being formed, something maybe even like a systemic insult, maybe like the kid got really sick or something, it just affected the way those teeth grew up and those teeth formed. And so my plan for that day to get the kid out of pain was to sadly, extract those 2 front teeth. An endo consult was sent out for maybe to see if maybe a root canal could be done, but the endodontist came back and said, yeah, we can't do a root canal, that has to be extracted. So this is the teeth after it's been extracted. If you look at it, it's really, really odd. So these are the 2 front teeth. And it almost looks like as if like these, like there's almost like teeth on top of the other teeth, but this is just how it came out. And on the left, you can probably see that big bubble right there. That's the facial abscess. And I had a mirror down there, and you can see on the palate right there, that really big bubble. That's another big, pretty much like a big bubble of pus. So we had to, so as we extracted all that pus just gushed out. So it's kind of like pretty nasty, but it definitely relieved all that infection going on over there. And so for our plan for this kid is he definitely, doesn't have 2 front teeth. So we're going to make him a little flipper. A flipper is almost like a a kitty denture, and we just put it there and it will replace his 2 front teeth. So that's the plan for now. And once he's older and growth stabilizes, the plan is to, maybe either do an RPD, like a removable partial denture, or maybe even implants for his 2 front teeth. So this kind of gives options. So this right here is a pretty gnarly trauma that happened. I didn't do this case. I actually assisted my co-resident who did it. She did a really, really amazing job. So as you can see on the left, what happened was this kid was playing around in PE, fooling around, and he like smacked his head right into like one of those big metal racks that have chairs, and just went right into his mouth. And as you can see, those 2 teeth right here, they're just got laterally luxated. That just means it got pushed back. So tooth number 7 and 8 were laterally luxated and displaced palatally. And also tooth number 5 had some extrusion, some enamel dental fracture, Ellis class 2. And then number 26 also had an enamel fracture, or that's called Ellis class 1. So what our plan for this kid was we numbed him up, make sure he was nice and comfortable, and he was a trooper. And then we did dental alveolar repositioning. That's just a fancy term for me. We took those 2 front teeth that were hit back and just kind of put them back into its original positioning. And then after that, we did some passive splinting with some ortho brackets to really help keep the teeth in positioning. And we also did some protective resin restorations for number 25 down there. As you can see, it's probably a little bit chipped. And then our plan was to, wait 4 weeks for them to be in the splint, and then see them again in 4 weeks to reassess, test mobility, take some radiographs to see how it's healing, and maybe potentially remove the splint. And long term, or not really long term, but more of like after we take out the splint, we would explain to the parent that, if everything looks good, then we would definitely recommend initiating root canal procedures for 7 and 8, just because when a tooth is knocked that far back, what happens is the blood supply that pretty much nourishes and innervates our teeth is cut off. And so as a result, those teeth will most likely become necrotic, or the inside nerve of it dies out. So you definitely need a root canal to help prevent those teeth from being infected by bacteria. So just some kind of interesting trauma you'll definitely see in residency. And if you don't have experience with this, and just one day a kid walks into your office and like presents like this, you'll definitely be freaking out. So after dealing with all of this trauma, it would just be kind of very easy to manage. I mean, it definitely won't be easy just looking at it, but after having this experience, it becomes kind of muscle memory and knowing how to deal with it and giving instructions and things like that. And there's just kind of another case that I did that was pretty interesting. It was a mesioincisal facial fracture of number 8. This patient came in for a recall, and I just thought it would be a nice service for him to repair that chipped tooth with some composite resin. So we do some aesthetic dentistry in peds, but definitely not like those maybe crazy full mouth rehabs that those prosthodontists or veneers, those cosmetic dentists do. But we definitely do stuff that looks pretty cool from time to time. So for the next part of my presentation, I kind of want to shift my focus on to talking about pediatric dental residency applications. So if you feel like, hey, this is kind of interesting, maybe you're in dental school and you want to apply to a pedo residency, kind of want to have these slides to help you out, because definitely when I was applying, I was very overwhelmed with the amount of information and sometimes a lack of information. So hopefully this will help you guys out. So probably the first thing that comes to your mind is, what program should I apply to? So the link I provide there, that leads to the AAPD website, and it lists out all the residency programs in the United States. And just to kind of narrow down your list of which programs to apply to, I'll recommend to look into location, stipend or tuition, reputation, residency type, and special interests. So when I say location, initially, since I was born and raised in California, went to dental school in California, went to college in California, I kind of wanted to stay in California for my residency. But then my mentor in dental school, he actually kind of opened my eyes to setting my eyes and kind of scope to other places as well. He just told me that there's so many great residencies out there, so you kind of should expand your search. And after listening to him, I definitely don't regret that decision, as I'm, having a really good time and learning so much in my residency here. Stipend/tuition. So what's nice about residency is, unlike dental school, where a lot of times you pay to attend, For some residencies, if it's stipend based, this is a lot for like hospital programs, you actually get paid to learn. So that's kind of pretty nice, where instead of adding on to your bottomless pit of student debt, you get paid money. I mean, it's not very good money, but it's better than nothing. And then some programs too are tuition based. So you actually pay to be in a residency program. So typically those stipend paying programs are more competitive just because it's a better deal. Reputation's one. So different residencies, they almost have like their own sets of personalities and strengths. So maybe if your interests are like research or something like that, or getting a lot of sedation experience, different residencies will kind of cater towards that specific interest and that reputation. So that's another thing that maybe if you have one thing that's really interests you, you should kind of look into the different reputations and strengths of different programs. And for residency types, there's different types of programs. So there's a hospital-based program, there is a university-based program, and there's also a hybrid program. So a hybrid program is a combination of a hospital-based and a university-based. So for hospital-based, like the one I'm doing right now, you pretty much work at a hospital, so you get a lot of clinical experience. So you treat a lot of kids and get a lot of experience with special needs kids and medically complex kids. So that's the benefit if you feel like you want a lot of experience with clinical care, and if you really learn by doing things, I feel like a hospital-based program might be for you. University-based, this is kind of generalizing, but a lot of times, since you're associated with the university, a lot of times you have special interests, like maybe pursuing an MPH or a master's degree or doing research, then maybe that might be for you. And the hybrid program kind of combines both as well. And probably the next thing that you ask yourself is, how many programs should I apply to? After you kind of ask yourself, what program should I apply to? Definitely with it being virtual interviews, that kind of changed the game a little bit, but a good kind of rule of thumb is around 10 to 20 programs. If the interviews are mostly virtual, the benefit is that you don't have to travel to interview. So a lot of times in the past, if you had to travel, you had to be very selective about the interviews you also accept as well, because maybe if you have an interview one day and maybe you got another interview the other day, you'll have to kind of pick and choose because it'd be impossible, maybe like flying California one day and then going to like Washington other days. So you have to be selective about the choices and places to interview at. But if it's in virtual, the benefit was for some of my friends, they were able to interview at 2 places in one day just because of different time zones. So they got up and interviewed at maybe like 7 a.m. They finished that interview and then another interview maybe on the East Coast, and that was at like maybe 1 p.m. their time or something. So it just worked out that way. But if it were in person, it'd be physically impossible to, fly both places in one day, interview there. And a lot of times for residency interviews, there is a social the night before where you're going to have some drinks with like the residents one day, and then the next day it'll be an official interview in a suit where you talk to the program directors and the different attendings there. So a lot of times this kind of varies depending on if it's virtual or in person. So but I'll definitely still recommend like 10 to 20, so that way kind of maximize your chances of getting more interviews. And one thing that I'll recommend too is applying to at least one school of every program type, like I was talking about, just to kind of see what they're like, because a lot of times during the interviews you're learning about programs too. So applying to like a hospital-based program, a hybrid program, and also university-based program. And another thing that really helps too is having externships. I know like Children's Wisconsin, Texas A&M, they have different open externships. So a lot of times it can either be virtual, you have a little Zoom session, learn about the program, or you actually go there and fly in person and you pretty much shadow the residents and attendings, and you pretty much have like a day in the life, but you're kind of experiencing it firsthand. So that can definitely be helpful if you want to learn more about a different residency. And then other question is how to apply. So like Health for Dental School, there's a different portal for it. For a residency, it's called the Diapass. You have to input different information, like for personal information section, there's all this stuff they have to put in. And this is kind of a screenshot of what it looks like. See if there's like a section for personal info, academic history, supporting information, and program materials. And so just kind of some more stuff that you have to elaborate on. Let's see, for like experiences, you can talk about like employment, extracurricular activities, like your volunteer work, healthcare experiences, research, teaching experiences, dental experiences, One thing that I kind of want to talk about is program materials. A lot of times for different residency programs, they have different supplemental questions like in dental school. So you have to be very organized and know exactly, when these supplemental questions or maybe even supplemental fees are due. And sometimes you might even have to mail in like a check directly to them. So just really being attentive to all those dates as well. Let me go back real quick here. So this right here, what I thought was kind of interesting with COVID, there's a little section on the application I was applying called the COVID-19 impact. So you pretty much talk about how COVID-19 affect your application and things you kind of want to elaborate on. So that was kind of interesting that no one else really got to do before COVID. And it's another little screenshot right here. Once you submit your application and everything, there's a little tab called the check status tab. And by checking it, you can know exactly if and when your official transcripts got arrived or if they got processed, when your national board scores got processed, and if your letter writers have been working on your letters and everything like that. So it's different, they can update and check the status of everything that's going on. And so for cost to apply, applying to residency programs is not cheap. So for the match service, it's something kind of separate from a Diapass. I'll talk a little bit about later. The match service is something that our medical school colleagues go through. That's what they do to match into their like different specialties. And that's something that we in dentistry use as well for our residencies. And then in general, the cost to apply to the first program is $190, and each additional application to different programs around like $85. And some programs, like I said, have supplemental application fees, and that can range anywhere from $50 to $100. Some of them want you to pay with their credit card. Some is like a formal check you mail to them with a specific address. And I'll say roughly it's around 1/3 to half of the programs. And sending in your DAT and your national board scores is around like $40 per score report. And all this fees is not including the cost of, if it were in person, of your plane fee, of maybe your Ubers, of your hotels and all that stuff. So that can be another factor, maybe how many programs you apply to with cost in mind. And so for deadlines, different programs have different deadlines. I'll say the NYU Langone programs is usually a little bit earlier. I'll say August 15th. In general, it's not stated on paper, but I'll say pediatric dental programs are rolling applications, meaning the earlier bird gets the worm, so the earlier you apply, the better. As a lot of times as your applications are coming in, the program is kind of reviewing your stuff. So by the time even if you have very strong applications towards the end, if they already gave out all the interviews, then it's a little bit too late. So I'll definitely recommend applying around, submitting your applications like late June to early July. That would be a good kind of safe time to submit it in. And this right here is just kind of like a little checklist of things to do. One thing that I recommend is making it very easy for your letter writers. So what I like doing is getting like a little manila envelope and providing like your updated CV, your transcripts, your personal statement, and getting all organized and putting this nice envelope and giving to your letter writers, just because if maybe you give them like 5 separate emails or something, it just gets way too unorganized for them. They're doing you a service by writing you a letter, so make their lives a little bit easier, write a little thank you card. So just do that to make it a little bit easier for them. And this is like my little timeline right here. So on May 14th, that's when the Diapass portal opened. And then July 26th is when I submitted my apps. It was a little bit late. Part of the reason why it was a little bit late was because COVID delayed the release of our spring grades. So I had to wait for my spring grades to be done. So just COVID just kind of messed things up. I'll definitely recommend submitting the apps earlier. So around early July, mid June, late June is fine. First interview I got was around October 21st. Last interview was around December 19th. And the day that definitely won't forget, January 19th, that was match day. That's when you find out where you get in. for the match, it's a little bit different from dental school. Or let's say if you interview different dental schools and maybe you got accepted in like 5 places, you have the luxury of choosing from those 5 places where to go. But with match, you only get matched into 1 place. You don't have the luxury of choosing. So it was definitely very stressful waiting for that result. And this is just some general like residency interview tips. The typical questions like tell me about yourself, strengths and weaknesses, and like why pediatric dentistry. And what was also interesting about pedo residencies, I'm not sure if other residencies do this, but for pedo, they asked some oddball questions. One thing was teach me something. I even had to dance for one of my interviews, and some people had to sing for an interview. And some of the questions like, oh, I'm a crying kid, make me laugh. Or some of them say, oh, tell me a joke. So it kind of throws you off. So the first question they might ask might be, oh, like what inspired you to become get into pediatric dentistry? And also the second question will be out of nowhere, saying, oh, tell me a joke or something. And part of that too is, I guess the reasoning for doing that is, I guess, making it fun, but also really seeing how you respond to, I guess, chaos. Because a lot of times in a pediatric dental setting, there's just so much like things going on. So you kind of want to see how you respond to those situations that kind of throw you off guard. And just for kind of 4 more tips right here, in person, definitely turn your phone off. Please turn your phone off. A lot of times if you look at your phone, it can convey the message to people that you're not interested, and also maintaining a very presentable and professional experience, and also being very conscious of your behavior. Even during socials, there have been times where I've heard stories of residents doing inappropriate things during the socials. So definitely be on your best behavior, even though if it's a more relaxed setting, people are watching you and seeing your behavior. For virtual, one thing that I learned was having good lighting, maybe even investing in like a ring light or something. You can get that to kind of brighten your appearance a little bit. Having a do not disturb sign if you have roommates, really double checking technology. I know sometimes things like laggy internet or stuff is something out of your control, but just making sure everything works just helps. I feel like if you're lagging or things aren't working, it just poorly reflects upon you as a person. And also what's interesting too is a lot of times you have a Mac that where that little green light is, that's where the camera is. So if you look directly into it, it almost looks like you're maintaining this virtual eye contact. When a lot of times if maybe you're looking at the person and their little zoom bubble is on the right corner of your screen and you're looking at them, so you're like looking at them in like their eye virtually, but like how you appear on the cameras looks like you're kind of distracted looking somewhere else. That's something that like a lot of times we aren't used to thinking, but with Zoom, that's something you have to be very conscious of. Where is your virtual eye contact? And also last part too, wearing pants. Good thing when I was dancing for the camera, I was wearing my pants. So definitely be prepared at all times. And this is the last slide right here before the Q&A. For the national matching services, this is like what I said, what our medical colleagues use. So it's separate from a Diapass. So essentially what happens is if you rank, let's say if you interview at 5 programs, then you would rank those programs from 1 to 5 if you do want to rank them. So a lot of times if there's maybe a program out of the 5 that you absolutely do not want to go to, simply don't rank them, because by ranking a program, there is a chance that you might end up going there. So let's say you interview at 5 programs and you wouldn't mind going to all 5 of those programs, like they all appeal to you. So then you'll rank from 1 to 5, how you in the order of which you like them. So number 1 is, oh, I really want to go to this program. And number 5 is, I still wouldn't really mind going here, but definitely not as good as maybe my program ranked number 1. So like I said, again, don't rank any programs they absolutely do not like, because there is a possibility that you would end up there. And in addition to how you rank a program like 1 to 5, the programs will rank the candidates. So let's say if they interview 40 candidates, out of those 40, they'll be ranking them from 1 to 40. And for the match system, it will work in favor of the applicants. They have their little algorithm that I'm not smart enough to explain or understand. And then also there is, with stats, kind of I posted to the right, that there's a higher percentage of being matched with the more interviews that you rank. So for those applicants in this chart that may be interviewed at like from 1 to 3 places, their chance of matching is at 58%. That's what's scary, is a lot of times if maybe you're in that position, there's just knowing that, oh, there's like almost like a coin flip chance that either you'll be in a program or you won't match at all. And then for those people who are lucky enough to get like 10 plus interviews, your chance of matching into a program is 90%. So definitely increases your chances. So that kind of factors in maybe how many programs you apply to, because the more interviews you get with stats, it proves that you have a higher chance of matching, and matching means that you get into a program. So, and that's pretty much it. So the floor is open to any questions, and here's my IG. So feel free to DM me if you have any questions. I'm happy to answer.
That was awesome. Yeah, Dr. Liu, feel free to leave that last slide up just so students know where to find you. I got to say, that was a fantastic presentation. You really went above and beyond to sort of shed light on a path that a lot of students are interested in. So that was incredibly valuable. Thank you so much. Wow. I think we do have a number of questions in the chat. I'll go ahead and hand it off to Isabel, our chat moderator. Isabel, yes. Feel free to take it away.
Yeah, thank you so much, Dr. Liu, for that presentation. That was amazing. I feel like not a lot of people talk about those kinds of things. So from our questions from the chat, we have our first question. Is stats required for dental school, or courses like biocalculus can cover for the stats requirement if we talk to an advisor for the dental school?
So they're asking, is statistics required?
Yeah, I think they're asking, is stats required for dental school, like can biocalculus cover for the stats requirement?
I'll definitely ask that question with like your counselor. I'm kind of in opposition where I didn't take any math classes when I was an undergrad, is I fulfilled it with my AP requirements. So I'm not the best person to ask, and I'm sure different like programs for different schools will have different requirements. So definitely, I feel like it's a very like school specific question. So sorry, that wasn't very useful. Definitely reach out to like maybe your counselor or something like that to find out the info.
Yeah, I think that's the most surefire way of getting an answer. But yeah, I would say that like, I don't think typically stats isn't a requirement for most schools, but I know each school does have its own unique requirements. So reaching out to like a health professions advising center or going on to the school's website would probably be the most helpful.
For sure.
Thank you. That was a perfect answer. Okay, so we have another question. I am in dental school that uses pass-fail grading system. Would you recommend ADAT for students from pass and fail schools?
Okay, that's a good question, because for me, I was in a school that ranked all the students. But I do know with like some pass-fail schools, there's like a high pass or something like that. So that might be one way to distinguish it. But I also agree that that would be a good way to kind of distinguish yourself maybe from the pack of even doing ADAT. I do know for the ADAT, it does require a lot of preparation. I hear it's a little bit of a harder exam. I personally didn't take it, but I feel like there's definitely other ways that maybe you don't want to spend all that time and all those resources studying for it. Like I said, being really involved in like extracurriculars, shadowing, getting to know your pedo faculty and really well will definitely really help. But I feel like if you feel like you have that stuff and you want to manage kind of undertaking a pretty challenging test, I would recommend it, because it'll definitely show programs that you are, capable and able to handle the stresses of residency.
Thank you. And our next question is, how do you determine the reputation of a program?
So this is a very good question. If you go on different program websites at a certain time after research, they all sound very similar in the way they kind of talk about their program and of course showing their best face forward. So a lot of times I would say that's when you want to do maybe like those different externships, or you can actually physically be there and talk to the residents. So I feel like even within a residency, I feel like the residents almost have like a personality too. So maybe there might be a program where all the residents are very extroverted or something, or maybe similar age groups or things like that. So a lot of times physically talking to the residents and maybe doing these externships will really help the, I guess, personality and reputation of that program right there.
Thank you. Our next question is, was there a defining experience that led you to choose pediatrics over other specialties?
I guess, like I said, I was kind of weird in that, like, I knew I wanted to do it coming from like senior year of high school. And a lot of people even coming to dental school being like in their last year, they're still kind of deciding. So for me, it wasn't really one defining moment. It was more of like a series of different experiences as a kid, just having very positive experiences at my pediatric dental office. So that's kind of what led me to choosing pediatrics. But definitely in dental school, I was in my pediatric rotation. I had really good experiences there. Those kids were super cute and I had really fun. So that kind of further solidified that, oh, maybe this path is something that I chose for myself and something that I would enjoy. And even during residency too, there's been moments where, it kind of further confirms that this is something that I really enjoy doing.
That's awesome. And we have time for one last question. What tool helped you out most when studying for the GRE?
So for the GRE, it's not correct me if I'm wrong, but I don't think it's required for those applying to pediatric dental residency. As I do know that for my friends applying to ortho residencies for orthodontics, they had to take the GRE, but for pedo, we didn't have to take the GRE.
That was, yeah, fantastic. I guess I just want to end on one last question. This kind of alludes back to your most recent response to one of the questions submitted by the viewers, but I feel like something that a lot of students can relate to is going into dental school. It's common for students to be really laser focused in on like a specialty that they want to pursue. There is, I assume, like a cost and benefit to being that focused and that sort of honed in on a specialty that early. Do you have any advice on just like navigating that decision-making process?
I feel like what's definitely useful in dental school is you go through different rotations. So you'll have like your pedo rotation, you have like your endo rotation where you do root canals, your oral surgery rotation. And usually that's not until maybe you're like your second or third year. So I feel like a lot of times things might seem appealing on paper, but when you're actually in the trenches doing that work, it's completely different for some people. So I would say being hands-on in those rotations, asking all those questions, asking those faculty, because those people in the rotations are like those board certified orthodontists and pediatric dentists and everything like that, kind of picking their brains out, asking them like, hey, how was your residency experience? Like, would you recommend this if maybe you were to redo dental school or something like that? Kind of asking those questions and picking their brains out. I feel like that'll definitely be helpful in helping decide. I definitely agree being like so laser focused has benefits and its cons and everything like that. But also keeping an open mind is definitely very beneficial if that's the case, because there could be things where maybe that you wouldn't expect yourself being interested in. So yeah, good question.
Right. So just be a sponge and take in as much as you can. And
I mean, just be a
I love it. Well, thank you again, Dr. Liu, and thank you to everyone who tuned in today. For the attendees, for the viewers, please give Dr. Liu a follow on social media and make sure to stay tuned for more of our sessions. Dr. Liu, we wish you a productive year. Thanks again and take care.
All right, thank you so much, guys. Have a nice night.
You too.
Thank you.